And as always, we're going to start things off with the COVID-19 situation here in Korea. Though we're seeing a drop in the number of infections after what health experts have called a peak last week, authorities remain on high alert while at the same time slightly easing social distancing guidelines.
For more, we turn to Shin Ye-eun, who's joining us live in the studio with us. Good morning, Ye-eun.
Good morning.
So, like always, let's start with today's updates.
Well, Mokyeon, we're expecting to see the daily tally hover in the 200,000s because up to 9 p.m. on Sunday, we've already reported 204,054 new infections, and this was down by 114,784 infections from the same time the day before, and is quite similar to what had been reported during the same time frame last week. We're just seeing the spread of COVID-19 slow down after hitting an all-time high last Wednesday when caseloads went above 540,000. Likewise, health authorities have said we've been facing the peak of the Omicron wave and have forecast that new infections will decline significantly from next week.
So, yeah, and obviously, maybe due to the peak of the Omicron, a number of people have expressed their discomfort, whether it be our colleagues and so forth, but also particularly the pharmacies as well. Can you tell us about that?
Sure. Because the government has made at-home recovery the norm, most of the population had to secure their own medication. In other words, those infected would call up local hospitals or clinics, which would then prescribe medication for those looking after them to pick up. But the problem was that there weren't enough drugs to give out, not even cough medicine, because there were way too many people looking for it. Whether it's those infected with COVID-19 or those reporting similar symptoms, which include coughing, phlegm, and a fever. Take a listen to the difficulties pharmacists here are facing on a daily basis.
Whether it's a direct transaction or a wholesale drug, there's not enough medication left in stock. While there are more prescriptions, we're running out of both specialized and general drugs.
We can't place additional orders now because they won't come, so I have to dispense medicine with similar compounds. But I'm panicking because I can't do that forever. Of the 40 years since I opened this pharmacy, I've never faced this kind of situation before.
All right, but despite so, Ye-eun, we hear that authorities have decided to slightly ease social distancing measures beginning today. So can you tell us more on that?
That's right. So firstly, South Korean health authorities have eased the country's social distancing guidelines to allow larger gatherings of up to 8 people. And this is 2 more than what had been a maximum of 6 people up to Sunday. Business hours for restaurants and cafes will remain the same, though, having to close at 11 p.m. Health authorities have decided to modify their antivirus measures now, despite concerns from some health experts that the scale of the pandemic could expand amid the surge of Omicron. Officials said, though, that they would only make slight tweaks to the extent that it doesn't make the situation worse or increase strain on the medical system. And this explains why they have decided not to extend business operation hours from 11 p.m. to midnight. And more measures have been eased specifically for those who have been fully vaccinated. From Monday, travelers who have been fully vaccinated in Korea or abroad will be able to enter the country without a 7-day quarantine period. Those who have been vaccinated overseas must submit a proof of vaccination to a public health center. Also, while this latest measure will apply to travelers from most countries, it won't be applied to those coming in from Pakistan, Uzbekistan, Ukraine, or Myanmar who still have to quarantine. Another new COVID-19 measure to kick off today is giving boosters to teens aged 12 to 17 who had their second vaccine shot more than 3 months ago.
Yeah, hopefully these easing of the restrictions doesn't lead to another uptick and we finally do see that downtick in cases, right? Yeah, and as always, thank you very much for your report.
Thank you so much.